do we know from the time that you get the vaccine to the time that you produce enough antibodies for you to, I don't know if you measure the titers or what kind of blood test you get, but how long does it take for you to call somebody you're immune and you're safe for Ebola? Is it in days or weeks, or what's the mechanism?
Yeah, that's a great question. And in fact, the answer was found out in the trial. So in the first week, really in the first 10 days after vaccination, there was no evidence that the vaccine was working. But after 10 days, it appeared to be 100% protective, at least for the next 3 or 4 weeks. So you're right. It does take time for the antibody response to build up. This is true of all vaccines. You wouldn't expect it to work after a few days. And in fact, there are data from the trial showing that indeed in the first week after vaccination, there was the same number of cases in the control group and in those who got the vaccine. So yes, it won't protect you immediately, but it will protect pretty well after 10 days.
This is obviously a fantastic vaccine that's going to save many lives. And I wish we had this about 6 to 9 months ago. We could have saved thousands of people. Now, obviously, if you've had Ebola, you don't need this vaccine anymore because you have enough immune and antibodies built and you're secure from that. So who would be a good candidate for this? Are you going to immunize everybody, or is it like someone in your, because I guess, I don't know if there's enough of this vaccine to go around. Are you going after people who've been exposed in the family or at higher risk, or are you going to immune everybody?
Yeah, so there are really two types of Ebola vaccine that are needed, and needed fairly urgently. The most urgent one is something you can use in an outbreak situation, like we have in Guinea today, where you can go and vaccinate around every case and try and stop the contacts getting infected by that case. And that's what has been assessed in this recent trial. So we already have a vaccine that works fairly quickly, as we said, in 10 days, but then protects very, very well. So this is the Merck vaccine that was in that trial, and I think it's relatively likely that that will be manufactured fairly inexpensively and made available for that objective. Remember, it's not licensed yet. This is very new data, but hopefully it'll be licensed in the near future for general use. But as well as that, you need another vaccine that you or I could take if we were, say, going to a country where Ebola was around, and that might protect us not for a few weeks, but for months or for ideally years. And frankly, we don't know if we have that sort of vaccine yet. There's the Merck vaccine that we know now protects at least for a short while. It may protect for longer. You mentioned Johnson & Johnson. They and GSK are developing what are probably going to be more powerful vaccines that will need a couple of shots rather than a single shot. And that would, I think, be particularly good for giving long-term protection. But it's too early to know whether they're really working yet or not. But as you say, you probably need different vaccines for different purposes to
Well,
control
this is
Ebola.
Certainly, I think it's a game changer. And we were desperately waiting for this vaccine, and I appreciate all of your input in this. You're always more than welcome, if you happen to be in New York, to come as our guest in the studio, and I appreciate your input.